House Resolution 3962. Okay, so the House Speaker and probably many Democrats very happy about this passage. But what about the opposition? Republicans. Joining us now, Congressman Michael Burgess, Republican from Texas and a licensed physician. He joins us now live from Capitol Hill. Tell us how you're feeling, sir.
Well, I think, Don, is very kind of you to have me on. I think we knew this moment was coming. We didn't know quite how it would play out at the end. I'm obviously disappointed we didn't hold our side completely together. I do hope people realize that a single Republican vote does not make this a bipartisan bill. A year ago, when President Obama won the election, we knew this day was coming. I frankly thought it would be here much earlier than today, and now we're just a year away from the next election. And you know that many of those 38 or 39 Democrats that voted against this bill were looking over their shoulders at the next election. I suspect there are some other people who will encounter some anxiety at home in their districts because of their vote on this bill. So we'll just have to see how that plays out. Listen,
as a physician, I'm going to go through some of the points of this bill, and
sure.
I want to talk to you. But real quickly, before we get to that. So what happens next? Do Republicans now in the House rally the folks, their counterparts in the Senate, to not pass a bill there? I mean, what happens next for the opposition to these health care bills?
Well, I'll just tell you, from my brief 7 years here, if you're counting on the Senate to save your neck, you may be too far gone. But clearly the Senate will watch what happens. There's not been bipartisan support for this bill on the Senate side. Senator Lieberman has said that he will vote to continue a filibuster if one occurs. So they have the votes on the Senate side, but they don't have the votes on the Senate side. Same as the House. They had a clear majority in the House, but it took them some time to even get with a 40-vote cushion. It took them a while to get to this slim victory that they had tonight. I suspect the same thing will be true on the Senate side as well. And don't underestimate the American people on this. After all, it was the American people. And you and I talked in the middle of August about the town hall phenomenon. I rather suspect a lot of that anxiety that people were exhibiting last summer, I suspect that has not been mollified, and we may well hear from the American people over and over again before the Senate takes this vote. Remember, we did cap and trade in June. It was a bad idea, a bad vote. Many members of the House went home and heard from their constituents. Many members of the Senate went home and heard from their constituents, and we have not seen the cap and trade vote come back in the Senate.
You know, and let's hope this happens, because you and I talked about this when you were on. Let's hope, there is at least a modicum, or even more than that, of decorum, and that people are respectful. And because there's so much emotion attached to this, I think sometimes people go overboard on both sides. I'm talking about on both sides of this issue.
But Don, realistically, that decorum cannot just apply to Republicans. And unfortunately, what I hear
just said on both sides,
people require decorum from Republicans, but then we can be exposed to the most vicious partisan activity that anyone could ever imagine.
Hey, so listen, you were talking about the Senate. You said, you've been there for 7 years, so don't count on the Senate. I'm going to read this to you, and then I'm going to let my colleague Brianna Keeler, who actually got this statement, she's going to talk about it a little bit more, but that's after you. So this is from Senate Majority Leader Harry Reid, Congressman. He says, tonight's House vote is another mile traveled on the road to achieving reform of our broken health insurance system. I commend Speaker Pelosi and her leadership team for shepherding a strong bill to passage despite the lack of cooperation from congressional Republicans. And then he goes on to say a little bit more, and I'll let our congressional correspondent get into that.
Sure.
Obviously, you're not surprised by this statement, right?
No, but Don, on your station early this morning when I was watching, someone talked about a new CNN poll. Said 26% of people wanted this bill to pass with no changes. 25% said it would need some major work, and 33% said go back to the beginning and start over.
And some people said forget it. I think it was like 15% that said don't even work on it at all.
Yeah, right. And it's hard to know where they come down on this, whether they just don't care or they don't want us to touch it. So that's you've only got 26% of the American people who are in favor of what we did tonight. That's got to be chilling if you're especially if you're a Democrat in a Republican district, a Republican-leaning district, going home to face your constituents now for a week.
I think you bring up a very good point. And also some people say, and I'm just getting, as we go here to get some guidance, we were talking about health care reform in general, and just by saying, I said earlier that I think it's fair to say that most people want health care reform. I'm not talking about specific bills. And even in that, there was, I got some nasty comments. I think it's fair to say that most of America wants our health care system reformed. They're not happy with particular bills coming from either side, but this shouldn't this show us at least that people want it and that we need to work on it regardless of how we feel about a particular bill, that we need to come to some sort of consensus about this?
Well, I wouldn't disagree with that. I have worked on the concept of dealing with pre-existing conditions without exposing the nation to unconstitutional mandates. I do think there is a way to do that. I introduced a bill previously, 4019, for people keeping score at home that does that, and another bill right along with it that deals with flexibility in the COBRA system. There are plenty of things we could do to make life better for Americans within the purview of what is legal and right for us to do.
Okay.
But it's not legal and right for us to create these big unconstitutional mandates. And who benefits? Well, the insurance companies, the very people who've been vilified in this debate, are actually the ones who are going to walk away with the biggest share of the prize.
And guess what? That's the reason we had you on. And just before we get to this bill, there are two pieces of business I want to handle. And we're going to come back to you, Congressman Burgess. So stand by. We're waiting on the House Speaker, Nancy Pelosi. She's going to speak, we're told, in just a little bit. And then we want to get that poll up. There you go. There you see where she's going to walk up and speak right there. And then the one that you were talking about, Congressman, here it says, pass with few changes, 26%. Pass with major changes, 33%. Start from scratch, 24%. Stop working on health care, 15% say... 15% of Americans say that. So 15%, I should say, at least of the people who are polled say that. But here's the interesting thing, too. I had someone on from Politico, Congressman, who said it really depends on how you ask the question as to what response you get from a poll.
Yeah, absolutely.
Yeah. Okay, good. That said, simple enough. You're right. That said, hey, listen, hang on. We want to get to break, but real quickly, Congressman, I want to say to this. Talk about what is... we want to talk about some of the things that are in here. We're going to get to break in just a minute. Sure. Who's covered? They said about 96% of legal residents under the age of 65 compared to 83% now. The cost here, 1.055 trillion. The net cost is $894 billion. How's it paid for? $464 billion over the next decade for new income taxes on single people making more than $500,000 a year, and then on and on. Requirements for individuals. Individuals must have insurance. So what is the issue here really with the opposition? Is it really that the government, that this bill sort of proposes that the government be in charge of health care? Is it the cost? I don't think the opposition is to the number of people who are covered under this. Correct me if I'm wrong.
No opposition to the number of people who are covered. In fact, I had some disagreements with my leadership on their alternative because I don't think they paid enough attention to coverage. It doesn't do any good to deal with insurance reform if ultimately people don't pick it up and don't have. The greatest expansion in this bill, of course, is bringing new populations into Medicaid. Medicaid is a federal entitlement program. It's going broke. We can't sustain it. And so we double down on that program. And the states themselves are telling us that we can't take what you're giving us in Medicaid. We will have no dollars left for education or transportation. It'll all be spent on health care at the state level.
Congress, you spent a big chunk of time with us, and we appreciate it. You're talking about who's going to pay for this bill, right? So we need to pay the bills as well. So here we go. We have to go to break, and then we want to also get this out of the way before the House Speaker comes out, because we don't want to be in a break when she comes out. U.S. Congressman Michael C. Burgess, North Texas.
Thank you.
Opposition. Thank you very much. House Speaker Nancy Pelosi coming up just moments away after the break.